So health disparities falls under a category of research that we call health services research. So health services looks at how is it that patients access care, barriers that they may have to care, then their outcomes once they come into contact with the healthcare system, and then it tries to evaluate all of these aspects with a lens in health equity and trying to ensure that patients have access to care independent of the socioeconomic background, race, ethnicity, immigration status, or any sort of other characteristic. So my research is looking at health disparities in Huntington's disease, starting very broadly with having a good understanding of how many racial and ethnic minority groups have Huntington's disease. Using Enroll-HD, we're looking at things like disability, level of disability once they start this study, which may be a marker or a surrogate to a delay in accessing care. So for example, sadly we're finding that Black patients do have more disability when they enter the study, suggesting that, if they're entering the study with more disability, that may mean that they're accessing a Health HD Center of Excellence with more disability. Again, a surrogate or some sort of suggestion that there might have been a delay in accessing specialized care. And then some of the other things that we're also finding is that from time of symptom onset to time of diagnosis, on average in this data set, it tends to be close to about 3.5 years for white non-Hispanic patients. But Black patients are being diagnosed 4.5 years. So we're seeing a 1-year difference in terms of actual diagnosis from when the symptoms started. The main purpose of that is to be able, of understanding this, is to be able to provide early care, early connections, and early support for families. But also is important when it comes to clinical trials. When we're developing new medications and they have not been tested in all groups that have this disease, that is a problem. We don't know if it will be as effective in those communities. But then also, if we do identify medications that can slow down the disease progression, we want to ensure that all groups are getting a diagnosis as soon as possible and they have access to these therapies as soon as possible.